Good afternoon, ladies and gentlemen. Welcome to the Adults Health and Housing Cabinet Member meeting for Thursday, the 30th of March 2023 at 2 p.m. In the meeting, we have Jackie Costello, Henry Sipser and Ashley Warhurst, and Lindsay Stevens is corporate support. So welcome all of you. Are there any apologies, Lindsay?
No apologies.
Late items, and there is a late item which is from Jackie regarding the continuation of adult social care CareLink. And the reason for it being a late item is that the current contract actually finishes tomorrow, and so we need an urgent decision on this. So I'm prepared to accept this as a late item. Any declarations of interest? I'll take silence as none. And the minutes of the meeting held on the 15th of November 2022, and having read them, I have no objections. So thank you. In that case, then we move on to item 5, which is appointment of managing agent and publishing a statement of intent for ECO4 local authority flexible eligibility. I've got that all right, hopefully. And Henry, over to you.
We're looking to appoint, well, your authorisation to the council's authorisation to implement local authority flexible eligibility. ECO4 is a national energy efficiency programme, and ECO4 flexible eligibility gives councils an ability to widen the eligibility criteria out so more people can be eligible for that assistance. In order for us to do that, we have to publish a statement of intent which sets out the additional eligibility. We'll be using like an Ofgem template that they've given us, so we're not looking to do anything outside of that currently. And that'll enable, more people in Derby. It's about 40% of the postcodes would be eligible. It's only eligible to certain properties.
Can I interrupt you at that point and say, would it be private or social or a combination? And would it include financial eligibility as well?
It certainly includes financial eligibility, and it's for private sector only, isn't it? Private sector only. So yes, there are. It is a sort of means tested ability to pay. There are also other measures that we can use. They call them proxy measures. It's if in certain areas, if your child has got free school meals, that would enable you to qualify. But they're quite complex, all those. But which is also one of the other requests, is that we are allowed to appoint Yorkshire Energy Services as our managing agent for this. They provide this service to other local authorities. We've got very little capacity to deliver something like this, but we've a need to deliver it to enable more people to benefit from it. There's no charge to the council to provide that service, and what they will do is receive the applications. They'll vet the contractors that are carrying out the work, as well as carrying some of the work out themselves, I think, as well. Receive the applications, ensure that they meet all the eligibility criteria, all the audit criteria, then pass those to us for signing, and they will take on the responsibility for ensuring all that's correct.
Okay, well, can I ask at that point then, Yorkshire Energy must have a good track record for delivering this service, and you can assure me that they do meet the standards that we require?
Absolutely. They've been working with us for, it's about a year, isn't it now, on Lab 3, another project, an external wall insulation program called Lab 3 for about a year. They're a community interest company, and been working closely with us on giving energy advice and things like that. They're also performing the same service for several other local authorities.
That's right.
You know, so we're not the first to go down this road.
Okay, we've had no problems with them. I understand that we've had two different contractors on the Mackworth project, but you know, have we had any issues with that project that may need to be taken into account when we allocate this?
I know there were some issues with concluding the second phase a little bit, but there've been no issues with Yes Energy Services, Yorkshire Energy Services at all. They've been the feedback that we've received has been excellent, hasn't it, really, so far?
Okay, thank you. Anything else that you need to inform me of?
No, I don't think so.
So I'm being asked to publish the council's statement of intent,
Yes.
based on the Ofgem template, to appoint Yorkshire Energy Services to act as managing agent for Eco4 local authority flexible eligibility for the council, and to delegate approval to the strategic director of communities and place and the director of financial services in consultation with the cabinet member for adults, health and housing to enter into a memorandum of understanding with Yes to provide the managing agent functions under local authority flex, and negotiate and agree terms and enter into a deed of indemnity from Yorkshire Energy Service in favour of the council. Is that correct? Okay. There are no other issues that I wish to raise at this particular point. So as there's no other questioners in the room, I can give my approval to recommendation 2.1, 2.2 and 2.3. Thank you very much.
Thank you.
Okay, we now move on to the late item, and that's continuation of the temporary variation to the adult social care charging policy of CareLink. So that's over to you, Jackie.
So this is a follow-on paper from the approval to go from the report that came to the 15th of November. So it's really to allow CareLink to provide the Derby City response to the county-wide pause recovery service and allow those customers, patients coming through that pathway to have a non-chargeable service for a maximum of 12 weeks.
And what benefit will that give to our residents?
So in terms of residents, so they'll get a really fast response, an integrated response from both health and social care. It's really to support East Midlands Ambulance Service in reducing their 999 calls so they can respond to more critical incidents. So we have agreed to take their level 1 and level 2 stat calls in relation to falls. So CareLink can go out and respond very quickly with an integrated response with our DCHS staff to ensure that person is safe and is moved into a position where they can continue living at home. Okay,
I know that we're looking to extend the use of new technology, and with falls, it tends to be the more elderly population that are at most risk. So would they be able to operate this technology successfully, or could there be issues around the use of that technology?
I don't think there's a high risk of that, Councillor Webb, because Carelink already deliver similar services to about 6,000 of our residents already, who in the main are elderly and have no real issues in terms of customers being able to utilise the equipment. Installers go out, give them, a session on how to use the equipment. There's a 24-hour response service in terms of if they want any help over the phone, or a responder can go out again to ensure that the customer is operating the equipment safely.
Okay. I'm due to come and visit the Falls service in a couple of weeks' time, so I'll be interested to take a look at some of this technology and how effective it can be, because this is one of the ways that we can use technology to improve the offer to our residents, and particularly those at risk of falls. Does this come with falls? There can be simple measures taken, like grab handles, etc., that can be added to a property to make it safer. Would this be included with this project, or is that over and above?
That's over and above. They don't fit grab rails, but in terms of the integrated response, an OT will most probably go out and assess the environment as well to ensure that the customer has all the necessary equipment to ensure they can stay at home and safely. Okay,
and this finishes on the current contract finishes on the 31st of March, which is tomorrow, which is why this is an urgent late item, and this will extend the period from 31st of March 23 to 31st of March 24, and the 12-week support that they get will be non-chargeable.
That's right, yes.
And if they require any of the technology after that 12 weeks, then there will be a small charge for that. Right, yeah. Okay. In that case, I've got recommendation 3.1. which I'm not going to read out. It's a rather long recommendation, but it does include all the points that you've made, Jackie. And 3.2, to agree customers meeting the Falls Response Service criteria will not be subject to the following clause in the adult social care charging policy, and that is that all lifelines and other telecare equipment and services will be chargeable in full. So we're taking away that charge for those 12 weeks, and to agree that the period of free Carelink monitoring will start on the date the equipment of the date of the equipment installation, and will continue for a maximum period of 12 weeks. Okay, so I am happy to accept A, this is a late item, and B, recommendations 3.1 to 3.3, and I look forward to my visit to your Falls team in a couple of weeks' time.
You're very welcome, Councillor Webb. Thank you very much.
Thank you. That concludes the business of the meeting, so you can conclude the service.